Continuing our coverage now, fentanyl overdoses and deaths are taking a toll on southern Colorado. News 5's Maggie Bryan tells us just how prevalent the issue is and how agencies in Pueblo are coping with it.
But I'd say probably on average, we're probably using it 5 to 10 times a week.
Adam Heyman is an emergency medical officer for the Pueblo Fire Department. Giving Narcan to people is part of his weekly job.
We just revert to our training and we go in and do our job. There's not really a big emotional aspect to it at the time. It's usually afterwards that we'll experience emotions from it.
Becoming numb to the bigger issue facing the community: fentanyl drug overdoses and deaths. Since January, the Pueblo Health Department says Narcan has saved 191 people from overdosing on opioids. But Heyman says more needs to be done.
I think there needs to be a lot of education of when to use Narcan.
That's where Jude Solano steps in.
We're here as a resource for a lot of different services.
She's the CEO of Southern Colorado Harm Reduction Association.
We are meeting the needs of the community in terms of substance use disorders and really the crisis that's out there.
The agency has started giving out Kloxxado, an antidote like Narcan, but twice as strong to clients that walk in their doors. Only 1 dose is needed to save lives versus 3 or 4 doses of Narcan.
And not everybody has that on hand, so we were losing people.
The agency educates schools and businesses on how to administer the medicine.
Take it out of its container. Somebody is unconscious, they're not rousing.
The Pueblo Fire Department also keeps Narcan on hand.
The number one thing is to save their life, and then the emergency room deals with trying to get them help and taking them down the road to recovery.
And continues to battle the ongoing crisis.
Would you say it takes a special kind of person to do what you do?
Oh, absolutely.
Anybody can walk in our doors. We're here for the Pueblo community. Addiction knows no boundaries. It affects everybody.